Okay. Um, all right, let's start. Jamie, what have you been doing in the last few years in Plainfield, New Jersey?
I run a pet care business, taking care of dogs, sometimes some cats, walking dogs, and then also uh, taking care of dogs at my home.
And this isn't the first time you've been through a traumatic event, right? I mean, you were working in New York City during the
Yeah, no, I'm a
during
9/11 survivor,
9/11.
so I'm actually have part of my healthcare covered by the Zadroga Act, which is nice for the PTSD I suffered from getting caught in the second collapse of the tower. But this seems to be a new type of trauma. You think, you saw everything to that. I'm thinking, oh, that would be it for my life for traumatic events. This is sort of a much longer, drawn out trauma, or you
Well,
want it
what
to
is
be
it?
you want the word post to be inserted there.
What has it done to your dog walking business so far?
Pretty much decimated it, with the exception of service workers, healthcare workers. But even those, but I've continued actually to do them. I have two that are sick with COVID, but they let the dogs out, and I walk them from the yard and then return them to the yard while they've been ill. They are improving, I hope, but it has been 3 weeks, about 3 weeks for each of them.
What are you doing to protect yourself? I mean, in terms of going knocking on doors and getting dogs and so on.
Especially because they're healthcare workers. I actually had been slightly not feeling well since I had a doctor's appointment early in March. So, and I don't, as you know, God, John, hold on one second. Sorry, that's my, I'm cooking something in the oven. Sorry about alarming. But anyway, so I've just been masking and gloving I think since the 10th of March. Because, well, actually, no, the end of that week. So maybe the 15th. Because I hadn't been feeling well. I had gone and gotten a physical, which all came out great. And then I had blood work done the following Tuesday, which was maybe the 10th, right, 9th. And they weren't masking and gloving at all. And I was paranoid at that point. And so I started masking and gloving when I started not getting kind of flu-like symptoms by the weekend. I definitely had flu-like symptoms. And then right before St. Patrick's Day, I had actually 2 really bad days of flu. But I could not, because I kind of recovered quickly, I could not get tested at that point, especially at that point. And then it's just sort of been a bouncing back around. Whether I had COVID, I don't know. But then my client started to get sick. So, but one of them works as an intensive care nurse at one of our hospitals. And that about half that staff, I think, got sick. So this is up at Overlook Hospital.
Right, and as a freelance worker, you don't have unemployment.
We don't pay into the UI system, because I'm self-employed as a limited liability LLC. So that gives me some protection so I can't get sued, but you don't pay traditional unemployment, or you don't get disability, as you know, from helping me last summer when I broke my foot. But so I mean, supposedly, I haven't even tried because actually I'm still working, but I know some folks that have completely lost all their walking business are trying to apply to that, but I don't think they've had luck yet. But I don't know for sure.
So you haven't even tried to get through?
No, I mean, I have enough money to get through for now for a little bit. And hopefully, if by the time I do need it, I'll get through and use it. But I just want to continue on with what I've got, and as long as I can, and hopefully just avoid that mess, And I do think they're kind of maxed out. I think our testing's maxed out here because it seems to be almost the same amount of people are getting positive a day here. And I'm just wondering if the system is maxed from testing all the way to unemployment benefits. I just think the unemployment system in the country is, I used to deal with having a staffing company, and it just seems like they can't handle it. And so we're tapping out about 6 million for the unemployment. And then here in New Jersey, we seem to be getting a positive group about 3,300 a day that are positive. But I just think that's because that's the max they can do.
Terrifying. That to me, that's a terrifying number. That many people getting.
Yeah, we're up to 62,000 as of today. We're 61 and change, and 1,700 people on ventilators. I just looked at the stats.
Yeah.
So, and in town, we have close, I would imagine today we're probably over 500. And we're a city of about 45,000. So,
right. Well, what have you observed around town in terms of traffic, grocery stores, people sheltering?
I had a terrible experience Thursday. I went later in the day. I tried going midday, but it was really crowded. It was less crowded at the end of the day, but then there was absolutely nothing, very little in there, or like very little produce was left. This was a Stop and Shop. And very little of anything I could do. No half and half, no milk, no eggs, no bread. There might have been bread. No, I don't think there was even any bread. It was about 5:30 in the afternoon, or late afternoon, evening. But it kind of freaked me out. I had been there a week before, but it was early over 60, even though I'm not over 60 yet. And I went with my neighbor in separate cars, and it was pretty well supplied. I went then to a poorer area of Plainfield, the west side, and yesterday, and then bought all the stuff I couldn't find. Everything was stocked up. Now I since have heard that there was something online that people weren't social distancing properly there. So I'm wondering if that has affected that particular store. So they actually had items you could buy, like toilet paper, paper towels, and plenty of fresh produce. And so you see the power of social networking, right? So if a place gets a bad rep, and I've known the guys that own that, it's a family that owns it, and they're nothing but nice, and I would imagine because it's a poor area, they probably do have people that probably can't even afford to get masks, or maybe not even be educated, they actually have to wear them, and so I have gone there since the Great Recession to the drugstore next to there because I was without insurance for a long time. So they always had the best prices there, and it definitely serves the poor. It's a poor area, but I don't mind going over. And the people at the grocery store next door have always been very kind to me. So and they were social distancing. There might have been one person in there without a mask, but the night before I saw somebody at Stop and Shop that didn't have a mask on. So I don't know. But it's also an area people might be nervous about going over there.
What do you observe about your neighborhood? I mean, is there anything worth commenting in terms of the neighborhood you live in, which is sort of semi-suburban?
Yeah, well, the only thing I could notice since the mask thing that we got, I don't know what day that started getting suggested, is initially there were a lot of people out walking. And now what I've noticed, hardly anybody's out walking. And if they are walking, well, they don't always have masks on, but it's not it's a very old suburban neighborhood. But the homes are you've been here, it's like pretty big lots, right? I mean, we're not like too urban. This part of Plainfield is not like right next door to each other. So, there's not that many of us here, and there's not that many kids in the neighborhood. So the only thing I've noticed since maybe Wednesday is definitely a drop in people walking, like just being outside. I don't know if that's fear, or I think it's fear probably, because it's been night. Today's been beautiful. And I thought Easter, I'll see people walking. No, nobody's out. So that's a little weird, and very few cars, and being close to Newark, just the lack of planes. I mean, it's constant usually here. And you might,
what
now
about
it's
the
exciting.
what about the traffic on Route 22, which always seemed to me very busy?
I had been over there only a few times, but it's pretty quiet, you know, but it's not like shut down like the city. But you know, this area is a lot, I would say a lot of my neighbors are some work for transit, right? New Jersey Transit. They're people that have to work. So for our town, they're going to work. And I think probably that's why they're getting sick, you know? So it has a lot of middle class people with middle class jobs that are essential, you know. So combined with poverty and then obesity, and our Ward 1, I think, is our poorest ward, and that's where I go to the drugstore. They have the most cases. I think it's what percentage it is, but it's a big percentage.
Right. Is there anything else that you want to report on before we wind this up?
No, I think that's about it. I just hope it gets better, and I don't know how long this is going to take. So hopefully we'll see each other close soon.
Yeah, maybe. Probably in Vermont, if anywhere.
Yeah. I definitely feel like we're in the middle of. I wouldn't wish what our situation is down here with the volume of cases we have, and you know, and losing my neighbor right away in the first week or so. It's scary. You know, it's scary.
Okay, Jamie. Thank you very much for
Right.
reporting.
Thanks. Talk to you later.